that. The question is more of what we have than what we don't have. I mean, let's put it in context, Samson. And basically, if you look at the Ministry of Health explanation, what they are trying to say is that as at March, they had become aware that the COVAX vaccines were not coming, and therefore we were in a tight situation. Samson, before March, I had sat on your program in December, I had sat on it in January, I sat on it in February, and I had shared correspondence with you about the Indian government and the impediments they were putting in the way of Serum Institute of India, and the fact that it was going to affect the vaccine supply chain. And therefore, for me, to tell me that you got to know in March is a bit of a red herring. That is the first thing I'd want to place on record, because these are recorded tapes that Joy FM have, and I've spoken on other media houses. There are some that I've even shared with Kweku Bako when he's away in private, because we WhatsApp quite a lot. So they couldn't have, it didn't come in March. Then the next thing I want us to clear is that we're being given the impression that the Sheikh approached us. I have correspondence which I would share later, but for obvious reasons, that shows that a Minister of State actually wrote to the Sheikh on the 18th of February, with the Sheikh responding with a letter on the 19th of February to say that if you are interested, then I would make myself available. In that letter that the Sheikh used to reply, there is a Ministry of Health reference number for their letter that they sent to the Sheikh. So that's also not in dispute, and we will come to that later on. And the next question is, we're being given this impression that the Russian Development Fund only deals through middlemen. I want to place on record that that is also not very accurate. They deal through middlemen, yes, but I know of Slovakia, which has done a direct contract with them. I know of Hungary. I know of Czech Republic. I know of Brazil. I know of Guinea in Africa, who've done direct contracts. And in fact, it's instructive to know that on Thursday, Joe Biden, the president of the United States, said that Russia, and particularly Vladimir Putin, was engaging in vaccine geopolitics, and that the U.S. was going to respond, leading to the U.S. moving from 80 million doses to 500 million doses promised to COVAX. That tells you that Putin was doing direct deals. In fact, there's record that he spoke to Ursula von der Leyen, which I have said on this program, when the EU were having the whole issues about obtaining vaccines. So that in itself is not also entirely accurate. What is accurate is that we went in late. So when you're doing geopolitics with somebody, the person needs to know, answer the key question, what's in it for me? And it seems to me that for the Russians, there's a lot in for the other countries they're dealing with, like they've done a direct deal recently with Iran, than dealing with countries like, unfortunately, Ghana, which leaves you to go through a middleman. And the WHO tape you played says something that's instructive. They say, if you would go through the middleman, you need to check and do due diligence on that middleman, because they are COVID vaccines, fake products that are being traded. And you've just played that on your tape. Now, here's the thing. In Ghana, the person who applied for the emergency use authorization is a known Ghanaian entity. Applied to the FDA, paid the requisite fees, and obtained the EUA. I have done my checks with this person, and there's no contractual obligation between him and Sheikh Maktoum. So I ask myself, how does my government then go into a contract with somebody who doesn't have emergency use authorization in the country? More importantly, if you look at the contract, it says that if we buy the vaccines and we use it and anything, they are absolved of blame. So then it brings me to the next question, that if there are Ghanaian companies, and the other contracts that have come out that Joy have put out, I've seen one from SL Global and all that, who are prepared and are also middlemen to bring in the products, and are in the country, and should something go haywire, can be held responsible because they are Ghanaian entities. Why are we dealing with this person from Dubai? Then finally, I'd want to end that this person is the same person who came into Ghana with Ameri. His two conduits are one person who's been a fugitive from justice in Norway for 10 years and an ex-convict in Norway who's moved to London. How on earth is it that you know that these are the characters you're dealing with? And we knew that as far back as February, Transparency International had flagged their dealings in Pakistan, which is still under investigation because they had fleeced the Pakistani government off. Why would you even go into a contractual obligation with such a character? In the end, they've defaulted on all their 3 dates that they have to deliver. People are making the argument that, when they came, they brought 15,000 doses to show that they could deliver. If you check, the 15,000 doses they brought were not matched pairs. Anyone who knows the Sputnik vaccine knows it comes as 2 unmatched pairs. So not like the AstraZeneca where the first dose is the same as the second dose. There are 2. So if someone is bringing in 15,000, it should be 7.5, 7.5. They brought 10 and 5. So at that time, we couldn't even use it. It was later that they brought the remaining 5,000. Was that also not a red flag? So I look at the contract and I look at all of the things that I'm finding out now, and I ask myself, did we really do due diligence? I'm not even yet coming to the costing because I know we'll go there.
Yeah.
But the picturesque of what we're dealing with, you understand me, the optics looks very murky.
All
and
right.
For me, that is the biggest thing.
Okay.